This is the Neurosurgery Podcast.
Welcome to this special episode of the Neurosurgery Podcast, the official podcast of the American Association of Neurological Surgeons. I'm Sandi Lam, a pediatric neurosurgeon at Ann and Robert H. Lurie Children's Hospital of Chicago. This is a special episode for Neurosurgery Awareness Month, highlighting the patient's journey. Most podcasts in the Neurosurgery Podcast talk about surgical techniques, scientific breakthroughs, clinical research, and innovation. Today, we're focusing on something equally important, the patient and the patient family journey.
And I'm Annalia Michelman. I'm the mom to a 7-year-old girl named Ruby who suffered a ruptured AVM about 4 months ago, and she was a patient of Dr. Lam's.
When neurosurgeons think about a case, we think about the diagnosis, the imaging, the surgery, and the outcomes. And families experience that very differently. Can you tell me about Ruby's story?
Yeah, well, she got a really bad headache one day, a day that started out perfectly normal. And it seemed to me to be regular run-of-the-mill kid sickness. She had a headache, she was vomiting. It seemed like a bad headache, but I didn't think all that much of it until it went on for several hours. And towards the end of the day, I started to think that she clearly was dehydrated. She'd been vomiting all day. And I just had a feeling that maybe something else was going on. So we are lucky enough to live close to Lurie Children's, and I brought her to the emergency department here. And I am so grateful to the team in the emergency department that looked at this kid who didn't have any neurological symptoms at that point. She had a headache and she was vomiting, but they noted that she had this headache come on really suddenly, and they said, let's do a CT scan just to make sure. And from that point, they realized what was going on, that she had a brain hemorrhage. She went into surgery that night at around 3 a.m., had an EVD inserted, went into the ICU for several days after that. Those first few days were spent doing imaging and tests, and your team understanding what was going on with her. And ultimately what happened was she had an embolization followed by a craniotomy with you, a very long surgery that, thank goodness, went perfectly. And we're here to talk about the patient's journey. So I kind of want to jump to the end of this story, which is to say that she's doing miraculously fine. She's a very lucky girl. She had a lot of things go right for her, and she had a wonderful team. And at this point, even 4 months out, she is a regular 7-year-old. She had this horrific experience where, she was brought into the hospital and very critically ill. So many things could have gone wrong, but they didn't. And she's okay, and she's somehow so okay that she's actually at overnight sleepaway camp this week, being a regular 7-year-old, running around, playing in the woods, swimming, having fun, singing songs around a campfire, which 4 months ago, I couldn't imagine that that's where she would be. And I'm so grateful to the team here for everything that you were able to do for her. But as I've reflected on this for the past 4 months, there are so many small moments from that time in the hospital with her and since that really shaped how I think about this experience and what we took away from it.
Can you tell me more about that? And I'm really interested to hear your perspectives as a mom and as a lawyer for the AMA with your professional background.
Yes, I have spent most of my career around and with doctors, although not in any clinical settings whatsoever. I'm an attorney. I've been at the AMA for about a decade. And I've been in the room for a lot of conversations amongst doctors. And I've heard the way that you all talk about interacting with patients and communicating with patients. And so while I certainly wouldn't say that I completely understand what it is like to be a doctor or how you think, I have a little bit of perspective on that maybe not everybody does. And it was really interesting to me to be on the other side of that, to be with the patient and the patient's family and to receive the communication from you and to really understand how important that was in the moment. There were small moments from our interactions that I have carried with me since. And so we thought it might be valuable to talk about some of those experiences. Because while I don't think it's groundbreaking or particularly novel to say that communication with patients and their family matters. Of course, you know that. Everybody listening to this podcast knows that. But maybe there would be an opportunity to provide some color to that, to talk about what it feels like to be on the receiving end of that communication and how various things kind of hit with us. So I thought we'd share some of those examples.
Can you describe Ruby to me?
She is a force of a little girl. She is fiercely independent, so much so that even 4 months after having major brain surgery, she was determined to go to overnight camp, sleepaway camp. It was really important to her, I think, that she be able to resume the things that she was able to do. But she is such a sweet little girl. She is so kind. She won I'm going to get the award wrong. She won an award at the end of the year assembly at her school for being thoughtful and kind to her classmates, which is really remarkable to me after what she went through.
Ruby is a remarkable 7-year-old girl, and I'm so glad that she's able to do all the things that she wants to do, and she gets to be a kid and have all of those memories of summer as a 7-year-old who just finished 2nd grade. And her award for being the most kind and thoughtful child of 2nd grade in the school is also a testament to Mom and Dad, you as role models, and how you have brought her up, and your bravery and resilience for her throughout this whole journey, and the way that you model your outlook on life is remarkable. And I'm so thrilled at her outcome from neurosurgery, but I'm so thrilled to consider you part of our community and our family because we have so much to learn from you.
Thank you.
In a neurosurgeon's life, communication is part of all of the other things, including the technical aspects of what we do for surgery and patient care. And I'm hearing from you that communication is essential. So can you give me an example of this?
Yeah, absolutely. The first time we met, Ruby had been in the hospital for a couple days. She was in the ICU. And you came in and talked to us about what was going on. You explained, what an AVM is, what was going on with Ruby's particular case, the process that you had gone through to recommend a treatment plan, what that would be, what the risks were, all of the things that you needed to convey to us. And then you told us about the follow-up plan. And you said that there was a small chance that this could recur even if her surgery was completely successful. And so you said that she would need to come in and have an MRI every year until she is an adult. And when I heard that, that was difficult to hear because I know that an MRI is not just let's check in every once in a while. see how you're feeling, see how Ruby's feeling. That's a lot. And so I was thinking, this follow-up has to occur every year until she's an adult. I'm never going to be able to exhale as a mom. This is always going to be hanging over. I'm going to be worrying about this until she was grown up. And then you added in something that I will never forget. And I've told so many people this story because I thought it was so comforting and well done. You said about those annual visits that you would get to watch Ruby grow up. And it was so touching and reassuring because in those few words, you were telling me that even though you couldn't guarantee the outcome of her surgery, you expected that she would get to grow up. And in that moment, you also sort of gave me permission to think about her in the future outside of this crisis that she was in. That I could, for a moment, picture her growing up as I had before we'd come into the hospital. And it also told me that even though we had this pretty extensive follow-up plan, we were in this together from here on out, that you were going to get to watch her grow up just like a family member would. And it was so touching to hear that we weren't alone in this. Ruby's dad and I and her, we have you'll be here through this process. It was something that I have thought about a lot since, and it was really meaningful.
Thank you for sharing that. I guess I've never thought about it in that way before, that the words we use and the words we choose stick with families. And I mean everything that I say, and I'm really excited to watch Ruby grow up. And I think this really highlights how words matter and how we build trust together when we communicate. And I think part of building trust is probably beyond words, right? I think of trust as words and actions. Can you share if there were moments like that?
Yeah, there was certainly one. The day before her surgery, she had this embolization procedure. And when she was brought back to her ICU room, she was in a lot of pain. And she was crying out in pain for a little longer than she should have been. There was some sort of miscommunication or mishap about how to handle her pain in that moment. And I don't want to dwell on that. It was resolved. It was fine. But it shook our confidence a little bit. I mean, here we are in this extraordinary hospital with this extraordinary team. We're going into this major brain surgery the next day, and there's something that happens the night before that didn't go exactly to plan. And I don't think that I would have remembered that experience, that there was maybe something not quite perfect about her pain management, except for the fact that later that evening, you came into her ICU room to talk to me about the plan for the next day. You said that you had heard that things didn't go exactly right earlier, and you wanted me to know what you were going to do to make sure that that didn't happen again. You said you would do a nerve block on her, certain pain medications would be available, and kind of what I could expect as her mom so that I wouldn't have to worry. And it was so meaningful to me, one, that you came down and talked to me on your own, because you didn't have to come down yourself. You could have relayed that message through somebody else, or even not at all. You could have just proceeded with the plan, however it was said at that point. But it meant so much that you came and you talked to me, and it said to me that you understood that we were worried, and it was important to you, not just that there was a plan in place to take care of this little girl, but also that it was important to you that I understood that there was a plan to take care of my little girl. And it really helped restore my feelings of confidence going into the next day, that was noticed, and that you took the time to come talk to me about it. It really helped with the trust and the confidence that I had going into the next day.
Thank you for sharing that. I thought I was just talking about the plan for the surgery, and that's actually a really important thing, that we're on the same page. And I wanted to make sure that you knew exactly what was going to happen, and that you knew that I value your trust, and it's a privilege to take care of your daughter. And by that time, you'd been in the hospital for a while and had really gone through quite a lot. And this leads us to surgery. Would you, or can you share what you remember about the day of the surgery?
Yes, I've thought about it. I've relived it a lot in my mind since, because I think it was one of, if not the most difficult things I've ever gone through, is having my child go through major brain surgery, and for me to be completely powerless in that moment. I've thought about it in retrospect. It brings to mind the same feelings that I had when I first had Ruby, when she was a baby. And I remember at that time that all of my emotions were overwhelming, that the love that I had for this little baby was physical at that point. And, it was this visceral, hormone-driven, like, love that I had for this little person. And there are moments in life where you get a little spike of that. I think, watching her go into kindergarten on the first day of school, you kind of feel that same intensity that I did when she was a baby. But for the most part, it is a simmer, right? It's not bubbling over. The emotion that I felt when she was in surgery was a complete bubbling over of feeling and emotion. And it was love for her, and it was sheer terror. I went back into her room, her ICU room, and I laid on that little sofa bed and just cried for, I think, the first 2 hours that she was in surgery. I just laid there and cried. It was so scary and gut-wrenching. And when I think back on it, it was really difficult to get through because of what was happening. But that feeling of helplessness that I had was helped by the things that we had been through with you in the days leading up to that we'd had these small moments where you had really built trust with me and with Ruby's dad, so that fear was at least somewhat contained. We knew that she was in good hands. We knew that you were doing everything you possibly could to take care of our baby. And it just reinforced to me how important those conversations beforehand were. That's one of the things that helped me get through that really terrible period.
Annalia, I'm grateful for your trust in me and our team for taking care of your daughter. It's a relationship that we've built together, and probably not by choice on your part, but we're incredibly honored and privileged to have that responsibility to take care of your daughter. So we've talked a lot about surgery and neurosurgery, but experiences like this often change people beyond the hospital. And I'd love to learn how this journey has shaped the way you think about things.
Yeah, it has. There's certainly the sense of you never know what the next day could bring, and, hug the people that you love. I certainly have that lesson. I've also learned a lot about how to support people because of how they supported me. I knew that I was surrounded by wonderful people before this, but the way that my friends and family and community circled around me and Ruby and her dad was, I can't even describe what that meant to me. The parents at Ruby's school put together a meal train, and there were parents that I have never even met, and I'm not even sure I could pick out their kids from her class, who were on my doorstep bringing me food because they knew that somebody in their community was having a hard time and needed support, and there they were. My colleagues at work picked up everything for me so that there was absolutely nothing else beyond caring for my family that I needed to worry about. So many people sent gifts to Ruby at the hospital to try to cheer her up a little bit. It meant so much. And the lesson to me is how to do that myself for somebody in the future when they need it. And I've seen the suggestions or recommendations that if you have somebody in your life going through a hard time, how you can support them. And I've read that you should show up to help without asking what somebody needs. Because when people ask me, what can I do to help? I didn't have an answer for that. I didn't know what they could do. But there were some people who didn't ask that question. They just came. So during Ruby's surgery, I spent those first 2 hours or so in the room crying. And then I got a text message from my friend and colleague who said that she was in the lobby of the hospital and I could come down if I wanted to, but I didn't have to. But she would be there for a while in case I decided to come down. And if she would have asked me if she should come, I would have told her absolutely not. No, I just want to be alone in my misery. But she didn't ask, she just showed up. And I eventually did go down to the lobby to talk with her, and it made me feel so much better. We cried in the lobby. The wonderful staff at the hospital brought us tissues. Later, my neighbor also just showed up to be there. She didn't ask. She just recognized that when somebody's in need, you just show up. And it was so meaningful to me. And I have thought about that so much, about how many people in my life just showed up and supported me. It has been one of the overwhelming lessons that I have taken from all of this, is how I can be a better person because of what I saw other people providing to me.
Those are very valuable lessons, and that renews my faith in human beings. That's beautiful. What you said really stands out because we often get wrapped up in life and we think about what's appropriate or what's okay or should I do that? And what you shared is that people didn't just offer. They didn't just say, let me know if you need anything. They showed up. And they showed up because they knew that there was need and they wanted to help, and they did. And I think that's a very powerful lesson beyond healthcare.
I think so too. And it is one of the things when I think about the way that you took care to communicate with me and with Ruby's dad, and the way that the people around me circled around and supported us. That's what I think about when I think about this whole experience. I mean, there was the horror of having my child go in for emergency brain surgery. But I think just as much about all of these little moments of my friend and colleague showing up in the lobby that day, and of the way that you communicated certain things. It has been so important to how I have been able to process this and get through it.
So listening to you today, we've learned so many things that you can't learn in a textbook or in neurosurgery training. And we spend years learning about anatomy and neurosurgery technique and making complex treatment decisions. And those skills are essential. But hearing your perspective reminds me and highlights to us that the family experience and the patient journey is experienced through a very different lens. The waiting and the uncertainty and the highs and the lows and the hope and the trust and the partnership that we built. And you showed us that the words we choose stay with families. The actions that we do, not just in surgery, but by showing up, matters. And you showed us that success isn't reflected in angiograms or MRIs. It's in your child going back to school, your child now being in sleepaway camp with her Girl Scout troop, and having that space and that hope to be able to think about Ruby's future. And that is beautiful. That gives meaning and purpose to what we do. Not just the neurosurgeon, but everybody in the healthcare team, and why we come every day and give it our all to try to help Ruby and your family and everybody going through this situation. And I hope that everybody listening to this podcast takes something away from this today. And I think that we can learn to be better neurosurgeons, better healthcare teammates, better supporters of patients and families, and better members of our communities and better people. So thank you so much for sharing with us. Thank you so much for being you. And thank you so much for really sharing your reflections to be able to help us understand our role as neurosurgeons and as members of society. And it is something that I do every day. I take care of patients and families and I talk to them. But I realize now in hearing your reflections and your stories that not only do I get to watch your daughter grow up when I see her in follow-up, but it is one of my greatest privileges to be able to watch her grow up. Thank you.
Thank you. I will be forever grateful for your skill as a surgeon, for saving my little girl. And that would be true even if you were a terrible communicator. But the care that you took with us, it was really touching. It changed our perspective on the whole experience. And I can't thank you enough for being there for us and being Ruby's doctor.
Thank you. And well, I hope this is a very good special podcast for the Neurosurgery podcast for the AANS. And this really highlights the patient's journey and what we can learn from all of this and what we can learn from you. Thank you.
Thank you.